Hi, I'm Christina and welcome back to another one of my cancer translation videos. I do cancer clinical research and I'm making these videos to help take some cancer topics and translate them from my native language of super complex medical scientific 9-syllable 23 consonant words into just normal words, so that maybe some of you out there can get a little bit of a better grasp of some of these ideas around cancer care and just what cancer is. So this video is pretty simple. Actually, most of you are probably going to already know a lot of what I talk about, but I just want to clear a few things up. So first, I'm going to draw your attention to my beautiful artwork here, which of course I'm kidding. I've already established in my first video that I am not a master of art, whiteboard art. But so everybody has heard somebody say, oh, so-and-so went to the doctor and had a scan and they found a mass and it's cancer. Well, let's think about this for a second. I'm gonna take my two lovely little guys here and I'm gonna draw a mass in their chest. Both of them have a mass now. Now, let's review quickly here from my first video. The very basic definition of cancer is a group of cells that are dividing rapidly out of control. So you can have tumors, hopefully most people know this. You can have tumors that are not cancer. They are what we call benign. And the difference between cancer, a tumor that is cancer, and a benign tumor is that a benign tumor is a very slow growing thing. It just kind of sits there, it doesn't cause trouble usually, and we usually just leave it alone. You can find this on a scan or something, but it doesn't cause too much trouble, so we just usually leave it where it is. So let's say that one of these guys has a mass that is cancer, but one of them has a mass that is benign. So you have some sort of imaging, we'll say, because of the angle here, let's call it a chest x-ray. Can you look at this picture and tell which one of these is a cancer and which one of these is a benign tumor? No, you can't. So what do we do? Should we tell them to go home since we need to wait and see if it grows really quickly? So say, come back in a couple months and let's see how big it got. They're probably not going to like that very much. That's not a good idea, right? So what do we need to do? We need to get a piece of that tumor. That's called getting a biopsy, right? Everybody's heard of that. We need to get a little piece of that tumor, give it to a pathologist, and let them look at it under a microscope. And they will be able to see evidence that these cells are rapidly dividing, that they're no longer normal cells, and that they're cancer cells. Now, I'm going to step away for a second and say, I know there's some of you out there that are going, wait, but a PET scan can tell you if something is benign or malignant. Whole different story, whole different topic. Let's leave that one alone for right now. Basic scans cannot. Okay, so back to here. So poor little guy over here on the left was our unfortunate one. He has the actual malignant or cancerous mass, aka tumor. So it's in, if we assume that that's actually in his lung, let's say it is, it's right there. So now he has lung cancer, right? Not so sure about that either. Let's do one of my fun analogies. Okay. I have some cheese. Okay, what kind of cheese is this? This should be easy. It's Swiss cheese, right? It's got holes, it's kind of whitish, you know. If you were here, you could spell it and you'd be able to tell it was Swiss cheese. All right, so let's imagine I have a magic wand, I wave it, I fly over the ocean, and I land in Russia. I still have my cheese with me. Is it still Swiss cheese? Or is it now Russian cheese? It's still Swiss cheese. Why? Because it still has holes, it's still kind of white, still sticky, it still tastes the same if I eat it. It's because we don't call it Swiss cheese because of where it is. We call it Swiss cheese because of its characteristics, right? Those don't change no matter where it goes. And it's the same thing with cancer. We don't call cancer whatever type it is because of where it is. We name cancer by its characteristics. Now, I don't want you to think too much about that analogy because it falls apart if you take it too far. It's not the best analogy. What I want you to take away from that is we don't name cancer by where you find it. We name it by its cells and its characteristics. And it's basically the cell type. So this guy has a tumor in his lung, but that doesn't mean he has lung cancer, because what he could have is he could have throat cancer that has spread to his lungs. And if he does, and the pathologist gets a biopsy of that lung tumor, those cells under there are going to look like cancer cells that started up there in his throat. They'll look the same as the tumor cells. I'll draw a tumor up here. Those kinds of cells in both are going to look the same. And so the thing is, so he doesn't have lung cancer and throat cancer. He just has throat cancer that has spread to his lungs. It's all about the cell type. It started in a cell in his throat. There's a certain kind of cell. There's several kinds of cells in your throat. So my guess is this will be a squamous cell. So it's squamous cell carcinoma of the throat. And it spread to his lungs. So he has throat cancer. Now, why am I making a big deal out of this? Because cancer is treated differently according to the type it is. You're not going to treat throat cancer the same way you're going to treat lung cancer. Different kinds of cancer respond differently to different kinds of treatment and different drugs. And that is also why we're probably not going to find a cure for cancer. Now wait, before you panic, I said we're probably not going to find a cure for cancer. As in, we're probably not going to find one drug that is going to cure everybody's cancer. We're probably going to find multiple things to take care of all of the different cancers, because cancer is not one disease. Cancer is not like diabetes. There's not one thing that you can fix and it'll all go away. Cancer of the breast is a different disease than cancer of the throat, is a different disease than cancer of the colon. They are different diseases, and it's very complex. And it's almost so complex that a cancer in one person, even if I have breast cancer and the person beside me has breast cancer, it's almost a different disease from mine to hers. It's different because there are always going to be different mutations in my cancer than there are in her cancer. So cancer is very complex. And it's not the same from one person to the next. So it's a whole group of diseases. So this whole idea of finding one cure for cancer is kind of not quite the right idea. So anyway, so basically what I'm coming back to is a biopsy is the holy grail of diagnosis. You got to have a biopsy to be diagnosed with cancer. You cannot be diagnosed with cancer without a biopsy. You first have to have a biopsy to know that you even have cancer, and then you also have to have a biopsy to know what kind of cancer you have so that you know what kind of treatment that you need to receive for your cancer. Now, quickly, what I also want to do is mention leukemia here, because I keep talking about solid tumors. And if you talk majority and minorities, yes, majority of cancers are solid tumor. However, there are also plenty of people with leukemia. And leukemias are what we call blood cancers, and some people even call liquid tumors, which is kind of a weird way to think of it, in my opinion. But, so I'm going to do some more of my beautiful artwork here. So imagine, stretch your imagination, and imagine I'm drawing a bone. And inside this bone is a cavity, which we call bone marrow. Your bone marrow is a cell-making factory. This is where in your body your cells, like your white blood cells and your red blood cells, get made. So when you go to the doctor and they draw your blood, and they do, if you've ever heard of a CBC, and they're checking all those blood counts, like your white blood cells and your red blood cells, that's where all those cells are made. They're made in your bone marrow. And those cells are, they're super important cells. They do all kinds of stuff in your body that you have to have done. These are important jobs. They do things for, they are important for immunity. They are important for carrying, oxygen to your cells, for clotting, for all kinds of stuff. They're super important. We got to have this marrow. It's super important, right? So, and like I said, it's a factory. It's making cells, and cells, just like complete humans, start out as babies and grow up. We call growing up, in scientific terms, differentiating. But in baby cells, the name for baby cells in medical terms are blast cells. Now, to step back to my first video again, we also said that cancer gets started when one cell loses the stop message it's supposed to get to tell it to stop reproducing. And it doesn't know to stop copying itself over and over again. So in leukemia, what happens is you've got one of these baby cells, one of these blast cells in here in this factory that's supposed to start out in this bone marrow factory and then differentiate or grow up and turn into a quote adult cell, or like a white blood cell or red blood cell, and go out into the bloodstream in the body and do its normal job. And that's what's supposed to happen. But one of these baby blast cells is the one that doesn't get the message to stop copying itself, and it keeps copying and copying and copying and copying, and that's how you get your cancer. And not only does it start copying, it stops right there at that stage. It doesn't grow up, it doesn't turn into a mature cell at all, and it goes out into the bloodstream as a baby cell, as a blast cell. So you get a different kind of effect. So with tumors, they're mostly, in the beginning, just going to affect what's around them, right? But here you got a different situation, because what happens is as these blast cells start filling up the marrow, they start impacting the marrow. They start making it so the marrow the factory can't do its work. It can't produce the cells like it's supposed to. So imagine this. I'll give you another little analogy. Imagine you have a little tiny town that you live in, and all of a sudden somebody waves a magic wand and 80% of the adults in your town are suddenly babies. They're on the ground, they're in diapers, they're crying, they want a bottle, and they want somebody to change their diapers. They can't do anything, they can't help with chores, they can't go to work and earn money, they can't make dinner, they can't drive, they can't, contribute to society at all. And so now you got 20% of the adults left in the town to do all the work for everybody. Pretty soon, that's going to turn into a whole lot of work. Now, imagine somebody waves a wand and doubles the amount of babies. Now you've got babies everywhere. You're tripping over babies. I mean, you can barely walk without stepping on one of those adorable little squishy babies. And so in leukemia, after a while, you can sometimes get what they call packed marrow. Your marrow is so full of these baby blast cells, you can get bone pain and stuff from it. But what ends up happening is, again, these little baby blast cells are going out into the circulation instead of grown-up cells. Babies, again, can't do anything. They're not good for anything. They're going out there into your circulation, and so you have these low blood counts because what they're testing for is adult cells. You don't have those. So all you have is these useless baby cells that are floating around in your bloodstream, can't do you any good. And so you have all these problems that are because you don't have your normal good adult functioning cells. So you have a different kind of effect that you're getting from leukemia. You still have a biopsy, you get a bone marrow biopsy that they punch in and they'll get a biopsy of the marrow here. But you don't have a solid mass sitting in one place. They're these blast cells that are circulating. So that's the basic idea behind leukemia. And again, there's another one of your myths I've heard people say before too about people with leukemia. I had heard somebody say one time, they told me that somebody had leukemia and said he's in the hospital and I've heard it's in his bone marrow. And I know when it's in your bone marrow, you're done for. And I said, huh? Well, he's got leukemia, right? That's kind of what leukemia is, right? That's when it's in your bone marrow. That doesn't mean you're on death's door. That's just what leukemia is. So, that's another one of those things. That is what leukemia is. It's when the cancer starts in your bone marrow. So, just a little explanation of the basic idea of what leukemia is. So, I hope that has been another little informative session for you, and it told you something you didn't know. And much more to come, more videos to come. Please remember to like and subscribe. I'm learning what that is. I'm new to this whole YouTube thing, and I'm learning you're supposed to say that. So please do that for me if you think these are helpful and you would like for me to keep posting some more. Also, feel free to put in the comments if there's some topics you'd like to hear about. Feel free to post those down in the comments and I'll see what I can do. Maybe I'll do a special video for you. All right. See you soon. Thanks.